Welcome back to Access Daily. If you're looking to drop some years off your face but don't want to go under the knife, there's a new procedure that's gaining popularity.
That's right. Joining us now to share the details is Dr. Daniel Campos. He's an advanced practice registered nurse specializing in aesthetic and anti-aging medicine and the beauty expert for people in Espanol. Welcome, bienvenido.
Welcome. It's a pleasure to be here.
As I said, he's actually 92. Zoom in on that face and look how good you too can look.
So this is really popular right now, right? Non-invasive cosmetic procedures that are essentially sort of a facelift but without the surgery, right?
Yeah, and these procedures, they come in different forms. They can be lasers, they can be deep ultrasound, Botox, fillers, also threads, lifting threads, right? I'm going to talk about that today. But the good thing is that they can take years off your face without having to go under the knife. That's why some celebrities, they choose this type of procedures.
Wow. I've been hearing about this threading thing. Okay, take us through the steps of what you're going to show us today.
Well, this procedure is like the combination of 3 of those modalities. It will be a lifting. We want to lift because as we age, the face starts to fall down. Then we also have volume replacement. The volume of the face starts shrinking. And also we have smoothing, the wrinkles. Nobody wants wrinkles, right? So this is a combination of those 3. And what this does is without having to go under the knife, we get to lift specific areas, like for example, around the jowl, they start to fall. And this is great because patients don't need general anesthesia, they don't need overnight stay, and there's no scars.
So basically, we're like a deflated balloon.
Yeah.
We start
to shrink a little bit.
Okay, we have a before of this patient. Okay,
Absolutely.
there she is. Tell us what we did.
You see her face start drooping. Even she has some unevenness. One side was flatter than the other one. You have some hollows around the eyes. The cheeks are start drooping. And obviously she has some wrinkles. So this was a perfect procedure for her. The first thing will be lifting. And we use this, the threads, the lifting threads. And what we go through a tiny hole, usually around here, this area. And,
there we go.
And we go, actually, it doesn't hurt. We use anesthesia. And then we go in under the skin. And this anchors to the fat, some fat pads on the face. And then we pull. Once we pull, we cut the excess, and voila, that's it.
Oh, wow. I know what you're... Okay, got it. So it's kind of like you're sewing, tightening them up a little bit.
Yes,
little
exactly.
sewing action right there.
Now, does the thread disintegrate in your skin?
Yes, yes,
literally
they do.
thread.
Yeah, it's a suture, and they dissolve. And the good thing about this, when you create trauma to the skin, the body heals that area, and in that healing process, we stimulate the production of collagen, and collagen stays in that area for a long time, improving even the skin.
And once you've sort of sewn up and tightened it a little bit, you talked about adding a little volume.
Correct.
How do you do that?
If the patient needs volume, that's the point where we go in with some fillers. And then we have different fillers. We have the hyaluronic acid, which is great to replace soft tissue, but we also have calcium hydroxyapatite, which is a filler that we put deep to the bone, and that helps me create facial structure. And that filler has its small spheres, and they become collagen. So it's great. It lasts a long time.
Does that hurt?
No, we use local anesthesia, and we use ice. We use topical anesthesia, and we use, we can give the patient a stress ball, like squeeze while we do the injection.
Ooh,
and that
watch.
helps. I had it done twice. I'm 48, and I would do it every time I need to because it keeps me looking younger and being an example to my patients.
You look incredible.
Thank you.
Yeah, you look like a filter.
Right? The Paris filter.
Put the filter
We just smoothed
like
it
the one
right
J-Lo
over.
likes to lose.
Permanently like that.
So, okay, now we've done the thread, we've done the collagen. What about the smoothing? What do you do to create that smooth
We do
effect?
that with Botox, and Botox is being used for a long time. Now the new trend is to use mini doses. What we do specific small amounts around the eyes, between the eyebrows, on the forehead, and that helps to refresh the area above the eyes. So this area will be definitely, if we don't do that, then this is too perfect, lifted, but then wrinkles here.
And let me ask you this, once you do those 3, and then that's it, right, as far as different
that's
procedures?
it.
And then do you notice right away, or do you got to let like a week go by and then you get the best results?
You get some swelling. Obviously, if you're gonna go to a party tomorrow, don't do it today. You get some swelling, you can get some bruising, but usually you see the effect, the lifting effect, you see immediately. So I will always tell patients, you could relax over the weekend, and then by Monday, I got it done on a Friday. On Monday, I was seeing patients, and people didn't notice.
You got the whole thing done.
The whole thing done.
Wow,
yeah.
that's a pretty quick turnaround.
Lean in here, Doc. This looks good.
Yeah.
Let's see our patient. We showed you the
Yes.
before. Let's see
Yeah.
her after.
You see,
Look how
around
good
the
she
eyes.
looks.
Oh, yeah, look at that. Yeah, and the neck and the jaw, like you said.
Definitely.
Oh, yeah.
How long will this last? Because the Botox and stuff will wear off.
Yeah, usually, obviously, the Botox we need to replace every 4 months or so, but the whole lift, it lasts up to a year and a half. So when we compare versus traditional surgery, the cost, the benefit, obviously this is something very
look at
well.
that's great right there, too. Look at it on the thing. Wow. And since it is sort of minimally invasive, are there risks associated still?
Yeah, this is a medical procedure. The fact that we say non-surgical doesn't mean that there cannot be complications. The most common, like I said, swelling, some bruising, but there can be infections too. So you have to discuss with your provider openly what are the potential complications that can have with this, so you're prepared.
Is this expensive? Is it? Can you give us a generalized kind of cost?
Well, a general cost, it goes from $2,800 to $3,500 versus a regular surgery, which can be up to $25,000.
If not more.
Yeah, if not more. Yeah. So.
Wow.
That's fascinating.
That's some good
That's
stuff.
really cool.
Those
Yeah,
pictures.
that you did
I keep
right
just
on.
staring at our filter right here.
Yeah,
For more
that's very
anti-aging tips, I'm going to do it. Follow Dr. Campos on Instagram. That's
Thank you,
awesome.
Dr. Campos.